Hi, everyone. My name is Dr. Nyla Fleming, and I will be your instructor for this course. I guess it would have been helpful if I would have put the name of the course on there, but that's an oversight definitely on my part. This is the first time that I've done one of these type of recordings, so just kind of bear with me. It'll get better as the semester goes on. And I also definitely welcome your feedback. So if there's things that I can do better, or if there's more information that you would like to see, just let me know. So right now we're just getting started with the course, and I know getting started in a course can feel really overwhelming. My goal is that you won't feel so overwhelmed. I know there is a lot of information that we will need to cover, but eventually you will make it down to that end point. There are some tips that I do have for success in this course. The big things is you'll need to stay on top of things. So review the syllabus, know when your deadlines are, because there are a few modules this semester where it is going to change. So just make sure you guys are looking at that ahead of time. And the next thing is to make sure that we are writing at the graduate level. For the submissions of the big papers, definitely you can't deter from that. For some of our course discussions, I'm definitely more lenient because those are personal and they should be more conversational. So I allow you to say things like things and I and it because that is the way that normal American conversation flows. For communicating with me, there are several different ways to communicate with me. Refer back to your syllabus. I do have a phone number listed. That number is for students only. Text me at that number, and then we can either continue conversation through text or we can set up a time to talk. I want that line to be used for emergencies only. So don't overwhelm me with the texting, even though I know that's how we communicate now. I want you to send most things through the course. So I prefer for the course that you send it through Canvas versus my university email because sometimes things do get lost that way. The other thing is to note that I do work full time and I work really kind of wonky hours. So sometimes you will get responses from me in the middle of the night or like it'll be midnight. Well, that's because I'm just like getting home and getting settled. Um, the next thing we're going to do is we're going to review week one. This week, you are being introduced further into primary care. Primary care is extremely important. It encompasses a lot of different things. And what you guys will find that a lot of healthcare right now is kind of incorporating what the nursing model has always been, which is a focus on disease prevention and wellness. Um, Primary care also treats a lot of common illnesses and chronic diseases. So it's a really wide range of things and knowledge that you will need to be responsible for. Primary care is also a place to get care coordinated between specialties. So primary care is super important. You will need to know the domains of wellness, and I've listed them out here because wellness is now something that is driving healthcare. It's not enough to give people medicine when they're sick. It is better, we have found, which again, that's the nursing model, is to keep people healthy longer. So if we can do things to prevent them from having disease, from having injury, we should do that. Things that you are going to see on your exam potentially and on your boards potentially, I have those marked with stars. So those are things that are extremely important for you to look at. Annual wellness exams is part of primary care. You need to know the components of a wellness exam. You need to know how to conduct a family and social history, which most of us already know how to do that before you even start the program. There is a high emphasis on chronic disease management. You will need to know when your routine health screenings are. I cannot tell you how important that one is, and also knowing your immunization schedule. Expect to see this type of questioning on your boards. So that's why those stars are there. So start learning it now. So by the time you get to your boards, that is ingrained in you very deeply. Other things you're going to be screening for are nutritional status, weight management, stress management, substance use, and abuse. Those are also extremely important, and you should know that. And remember, we are promoting wellness across the lifespan now. It's not just waiting until the patient is sick. We want to prevent illness. Obesity is huge right now. Make sure you have an understanding of how we come up with these numbers. So you should be able to calculate a BMI, and you should also know what is considered a healthy weight, what is considered obese and overweight. Those are important. I can almost guarantee that you'll see those on your boards. The medical complications of obesity, I have those starred as well. Obesity science is something that is really growing. And we know that there are a lot of things that are now attributed to excess weight. So you can look at this diagram here. It's not all inclusive, but it does include a lot of problems that we now know are associated with obesity. So definitely familiarize yourself with everything here. The causes for obesity is multifactorial. So there's not just one thing. It's not just you eat too much, and so that's why you're obese. There is genetic reasons for it. Something that you will need to know as prescribers is that there are certain medicines, specifically antidepressants, that may cause patients to gain weight. So you need to educate yourself about that. And environmental stuff, like we now know sleep deprivation, which us nurses, we are sleep deprived frequently, can also be a reason for excess. You'll need to know the components of an office visit. Some of us will go into weight management clinics. So you'll need to know what vitals you need to have for these patients. You always will need baseline labs. So CBCs, CMPs, you need to know what the patient's lipids are, thyroid. We're looking for reasons that could potentially explain obesity beyond just eating too much or the excess caloric intake. Another area that it's been around for a while, but it's growing and getting more emphasis is health promotion at work. Employers are finding value in that. So this is something to familiarize yourself with, and it is also something that you can expect to see on future boards and future testing. Sports physicals. This one is a big deal. You will do lots of sports physicals. I think most states now do allow nurse practitioners to do sports physicals. The main driving purpose behind sports physicals is the cardiac issues. So you're really looking for cardiac issues when we're doing these physicals. You want to make sure also that they do not have any uncontrolled illnesses such as asthma, because sometimes your visit may be the only visit that that child gets. So you want to make sure that their chronic things are managed as well. You're looking at their height, weight, blood pressure. Again, this may be the only visit that that child has that year, so it is important that we get those vitals. And if there are things that need to be addressed, we make sure that those things get addressed for our kids. Mental health screening has now made its way into the sports physical, which I think is absolutely phenomenal. Again, these children are not always interacting with the healthcare system regularly, so it is very important that we are screening them for mental health and getting them connected. As there are huge red flags. So this time, instead of making the star like little stars, I made a big red one for you. Things that should either make you pause or consider sending these children to a specialist for additional testing. If you have on that health history, they mark that there is sudden unexpected death in people in their family under the age of 50, you need to pause and get a very thorough history on that patient. If the patient says they have a family history or personal history of cardiomyopathy, long QT syndrome. You're noticing that when you look at this patient, they look a little Marfan-y, or they have Marfans in their family history. Super important. You don't want to just glaze by that. Those are the big ones. Other things you're looking at is exercise, and suddenly they're having chest pain with exercise. We got to dig a little deeper. So our job is to protect these children as we can. So if we find that there is something potentially wrong, we will send them on to specialists. So that may mean that they need to go see cardiology, because what we don't want to see is sudden death on the floor when there are things that we should have done in advance. Okay, so just make sure these are red flags. Make sure you know these for sports physical clinics. And finally, these are my references that if you want them, they're there, great. Most people on these types of lectures really don't care too much about the references, but they're there. One is your book, of course, and the CDC is an excellent resource. The government does a really good job of keeping up with that stuff and keeping knowledge up to date for us. So again, this is just a really quick run through of the week. There's a lot of reading there. Make sure you guys are doing your reading. Make sure you get the assignments in on time. Make sure you set time aside to study. If you have questions, I'm here. You have all of my contact information. I will be talking to you guys very soon. Bye.